Okay, Sam, good to see you again. Thanks very much for coming around.
It's always a pleasure,
And
Dr.
yeah, we really appreciate your thoughts and your information. Before we start, let me just introduce for the audience. I'm Dr. Bruce Garber. I'm the director of the Philadelphia Impotence Foundation. And Sam was kind enough to come visit with us today, and he's going to give us some of his thoughts and opinions about this topic. So Sam, remind me, how long we known each other now?
It's over 10 years now.
Over 10?
It'll be 11 this June.
Mm-hmm.
11 years I've met you.
Okay. And then I remember you developed ED related to...
As a result of prostate cancer.
Mm-hmm. Yeah. And then you were diagnosed, what, over 10 years ago, correct?
It was more than that. It was 2002 I was diagnosed when I had my prostate surgery. I had general surgery.
Right. So you were diagnosed with prostate cancer, and then you decided to have surgery for treatment, correct? They did a radical prostatectomy.
Yes, and that was way before the robotic surgery. It was developed, and it was a brutal surgery because it really knocked me down for a loop. But I recovered from that, and I was thankful. I knew I was going to develop ED within a short amount of time once I recovered. But my biggest fear was being incontinent, and I say that, but I recovered in that portion, but my ED just took over me.
Right. Now, I think you had some ED before your surgery, but it got worse afterwards? Is that
Yes, because I had a prostatitis. Am I saying that correctly? I had an inflamed prostate, and when I went there, when I gave it was another renowned Philadelphia hospital urologist. When I told him my family history, and after my examination, he told me I'd have to come there annually because because my father died of prostate cancer.
Yeah, let's get back to the ED issue. You were initially using, I think, pills, correct?
Yes, he gave me the pills while he was treating me before my surgery. And after my surgery, he continued to prescribe the medication.
Which ones were you taking?
I was taking Viagra.
Okay.
I was taking 50 milligrams, and they worked quite well. I was really impressed, with the overall results. But as time progressed, they took a toll. They stopped working.
Right. I frequently see this. Over time, they become hit or miss, or they stop working altogether. Especially, once you've had prostate surgery, almost every guy who's had prostate surgery is going to need some additional help to get their erections back. So once the pills stopped working, what further treatment did you try?
Well, at that point, I guess I could say I graduated into the injection medication, which was, I guess, out of desperation because I was a social guy and I liked going out and having fun, and now I found myself shying away from women, especially one-on-one situations where I knew I would fall on my face.
Right. This is a very common and important issue. When men get ED, it's embarrassing, it's frustrating, it's discouraging. Many men get depressed. Many men avoid interacting with potential partners because of this. It undermines their confidence, and it often gives them performance anxiety. Would you agree with
Oh,
what
I had it
just said?
100%, 150%.
Almost every guy gets this, and that's one of the reasons that I enjoy treating guys with ED. Because once we treat the ED, we can get rid of all of the embarrassment and the frustration and the depression, and
I had it all.
We can really help restore your confidence. In any event, how long were you using the needle?
I would say 4 or 5 months. 6 months was too much.
And tell us about it. What was that like?
It was horrible. I mean, I guess it was out of desperation. I was actually injected a needle in my penis, and I was doing it myself. And every time, I gave myself the injectable medication, I said I will never do it again because it was more painful than anything. As a result, I could gain an erection, but unbeknown to me, I was developing pyrones, and what I was experiencing, my penis was fully erect, but I had a complete 90-degree bend to the left, and it was painful, and I hated it. So I guess I thought maybe there was a learning curve or whatever, but I said, no, I stopped. I said, I can't
Yeah,
do it.
this is another very common scenario. Guys hear about the needle program, they try it for a period of time, but it's usually just a temporary solution because number of issues. Number one, it's expensive. Number two, it can be uncomfortable. Number three, many times it's hit or miss. Sometimes it works, sometimes it doesn't. Number four, a lot of guys just get tired of sticking a needle in their penis every single time they want to get an erection.
Totally agree.
It's not spontaneous. You have to have a whole kit and stop and inject and wait and hope it works.
And I was seeing this girl, and I used to have to take my syringe with me, and I was fearful of being stopped by the police for whatever reason and find a syringe on me. I'm like, oh my goodness.
Right. Then you have a little spot on your penis that's bleeding.
Oh,
so it's got a lot of issues that needle
I
program.
really hated it.
Right.
I used to hide it in a toothbrush container. That's how I transported it as I was all ready to go.
Right. And then once the needle was no good, I know you were with other doctors at that point at another hospital. And I remember, I think you were going to get the implant done elsewhere, correct?
Correct. Yeah, the surgeon that removed my prostate, he was treating me all along. He prescribed the medication, the Viagra, and the Caverject, the injectable. So when I told him I was ready for the implant, and he agreed. So he had me set up for a surgery date, and I was scheduled, and I was kind of nervous about it. So, but what happened? His office called me maybe a week before my scheduled surgery, and they moved his surgery date back.
They rescheduled your procedure.
They rescheduled, so I went along with it. So, but after the third time he rescheduled me, and I'm like, wait a minute, I don't want it, and I was really disenchanted with the whole thing. So
they rescheduled 3 times your
Three
procedure,
times.
right? Okay.
So, I mean, the surgeon, there's nothing against him, the urologist. So he called me back personally after I declined to have my implant procedure done. So he goes, well, what's wrong? He said, we talked about all this. I said, yeah. I said, but you reschedule me, you cancel, reschedule. So he confided with me that he needed an overseer in the operating room with him. So I sort of questioned that in my mind. So I confronted him with a question, well, how many of these implant procedures have you done? So he admitted he only 10 procedures, he's only done 10 implants. So I felt that he didn't have enough experience, and I was kind of shaky because, I mean, they're going to put a foreign object in the most sensitive part of my body, and it was kind of a little terrifying to me. But on the other side of the coin, I heard your name through friends. In fact, I met your surgical nurse, and she used to talk about you all the time. And she might have mentioned your name once or twice, and I was taking all this information in. But with that, when he rescheduled me that last time, and I said, so I went online and found you, and went in your office for examination and.
Right. Now, I think your instincts were good here because, with almost any operation, you're far better getting it done by someone who's done a whole lot of them as opposed to someone who's only done a couple of them.
Yes.
And that is especially true when it comes to these implants.
And
It's especially true.
I can, that date is recorded in my mind.
Which date?
When I initially saw you, and I confronted you with the same question, how many of these implant procedures have you done? And you sort of rolled your eyes and looked up at the ceiling. You went, 1,000, and this was 10 years ago. So it's got to be my assumption you're well over 3,000 implants by now. You're the man, and there's nobody that can top you.
Well, we specialize in this, that's for sure. We focus on it and we specialize it. Yeah, we did your procedure, about 10 years ago, right?
Yes, it was June the 9th, 2005.
You remember the day?
You never forget that day.
It was an important day in your life, correct?
It was the day I was reborn.
Right. Do you remember, did you have much pain afterwards?
Minuscule. You prescribed pain medication. I took one tablet, whatever it was, or a capsule. The first day I was home, and all it did was it put me to sleep. So I switched over to ice packs and Tylenol, and I was comfortable with that.
Mm-hmm.
And I used ice on myself for like 3 or 4 days, and
Good.
then one day the ice was too cold, so I knew I was,
Okay, so it
Much
sounds
healed.
like you didn't have that much pain.
no, not at all.
Now, in your, if I recall correctly, you had Peyronie's and you had some degree of like curvature to your penis.
It was radical. It was really bad.
Right. So when we did your procedure, not only did we do the implant, but we had to do a straightening job to get it straight.
Oh, it's straight as an arrow.
Now, we typically after the procedure, you got to let it heal about roughly 6 weeks, and
That's
then we
correct.
show you how to work it.
That's correct.
Can you tell me, is your implant easy to operate?
Oh, it's extremely easy, you know. I'm thinking in the back of my mind, when I recovered, and the first time I used it, you know, to this day, this woman doesn't know
Mm-hmm.
that, you know, she was penetrated by a penile implant. You know, I mean, it looked normal to her, and I
Mhm.
knew what was going on in reality. And you know, I had her 3 times. She never knew one time. She never knew.
Well, they're designed to be inside your body. They're unobtrusive, and if you don't tell someone, they're not going to know that you have an implant. What they're going to know is that for some reason, you can maintain an erection better than any other man they ever met.
That's so true. Because
Right.
she reached down and touched me. She goes, "My God, you're hard."
Mhm.
She didn't know I could hammer nails with it.
Right.
You know.
We don't recommend that, but you
No.
could. Yeah, so your device is easy to work, easy to inflate and deflate.
Yes.
And then we were able to get it reasonably straight for you, correct?
It's my Peyronie's is all in the past.
Mhm.
The love of my life, she's not with me right now, and she's home. We've been together 10 years, and this device enabled Ann and I to consummate our relationship.
Mm-hmm.
Without it, we'd still be sitting there looking at each other, you know. But it was a miraculous device, and
You have all the normal pleasure,
Everything, yeah.
sensation,
nothing
all
changes.
that is good?
Physically, you can do anything. I can do anything I want to do. I'm an avid sportsman. I'm out in the woods walking around, getting lost.
Mhm.
I can ride a bike, you know, ride a bicycle. That doesn't hinder me at all. I'm an extreme kite flyer.
Mhm.
I'm a model railroader. I'm always crawling under my layout.
So once you're healed, you can do pretty much whatever you like.
Nothing's stopping you at all. Nothing's
Right.
stopping you.
And then tell us more about the psychological side, like in terms of your sense of confidence and well-being. You think that was
Oh,
helped?
it's amazing.
Mhm.
You know, like I said, before my implant, you know, I wouldn't go out with just one woman. I would, believe it or not, I would go out with 2 and 3, maybe 4. They would come to my house, and my
Mhm.
neighbors thought I was a stud.
Mhm.
You know, but here there was safety in numbers, and I was
Because you knew you weren't going to
I
have
was
to be
protecting
intimate
myself.
with any of them, right?
yes.
Right.
So as soon as when I had my implant, and I recovered, and then I pulled my favorite one out of my little gal pal
Mm-hmm.
club, you know, and because we were all social dancers.
Mm-hmm.
We used to have a lot of fun, like on the weekends, and
Mm-hmm.
meeting up and just dancing and having fun,
Mm-hmm.
sharing conversation.
Okay. And then does she now know about your device?
Oh yes, oh yeah.
Okay. What's her thoughts or what's her reaction?
Ann loves it. She has no complaints at all. In fact, Ann, she'll take female conversations where I've had the guy won't call me, you know, to ask advice, and his wife will call me. So I said, wait a minute. So I'll give Ann the phone, and Ann will talk to the woman. And
It's helpful to hear both
Oh,
sides of the equation.
yeah,
It
'cause
definitely
it's
is.
it's a
There's questions
two-sided.
guys have, there's
It's a
questions
two-sided situation.
That
you
the
know,
partners
it's,
might have too.
it's like a couple's disease.
Mm-hmm.
You know, where you know, if one can't contribute to the sexuality portion of your relationship, but you're not going anywhere.
Right. What I found is that when the sex is working, it's just one normal part of a relationship. But when it's not working, it can grow to be a big problem. Would you think you would agree with that?
Oh, tremendous, yes.
Right.
And there's been so many funny facets to this, my implant, because I've met up with other implant patients, and, you know, we'd happen to see each other where Ann and I were down in Wildwood at a motel, and here there was a friend of mine who I
Mm-hmm.
introduced him to you, and instead of shaking hands, when we met each other, we started sword fighting.
Right.
You know,
There's all
and
kinds of things
we
you can do with it,
laughed.
right?
You know, and his girlfriend and my girlfriend, and we could just look at each other and know what we're thinking.
Right. But I think you would agree that these implants, they don't only restore your erection, they restore your sense of well-being, your confidence, you're feeling like you're a guy again, all that kind of stuff.
Yeah, even my subconscious mind is relaxed to the point where I don't have to concern myself with failing to achieve an erection, because I know I could just reach down and just pump this device up, and it's within 6 or 7 pumps. You know, this thing's
up.
ready to take off like a rocket.
Right. If it ever stopped working, you think you would have it done again?
Oh, of course, I'm not giving mine back. You know, I'm not giving it up.
Okay.
As we're sitting here talking, I don't even know I have it in me. I can't even feel it.
Yeah, it becomes like a natural
Totally
part of it. It's no
non-detectable.
different than a knee implant or anything else like that. And then, you have any other advice for guys who are struggling with ED?
Well, you know, I can't. Well, put it this way. Anybody that I've talked to that had an implant put in, we all have the same complaint, that we wasted time trying different things and, you know, well, maybe it'll improve. I wasted 3 years for my, you know, taking the oral medication, the injectable medication, and then, one thing I said to myself when I went in for the implant procedure, that I wouldn't have to stick myself ever again or pop one of those blue pills, because every time I took a blue pill, I couldn't breathe. I was all flushed, and especially the injectable ones. That was terrible.
Yeah. Well, you know, now you've got sort of the solution, and you know, it's a permanent solution. Once you get it done, you can cross this problem off of your list.
Oh, really?
It's always there. It's always ready. You can use it as much as you like, as often as you like, and it's a big sort of boost to your overall confidence and sense of well-being, at least from what I understand.
And the thing that I guess all of us are so lucky to have you in our area, because you are the specialist when it comes to penile implants. Because I've done my research, and there's only 5 physicians, I believe, in the United States that specialize
There's only a few who do a
in
whole lot
penile
of them.
implant
Yes.
procedures. We're fortunate to have you in the Philadelphia area. So it's a great job, Dr. Garber.
All right, listen, we really appreciate your thoughts, and this type of conversation can help a lot of other guys who are sort of thinking about it or struggling with this issue, can give them sort of the information that they might not be able to get any other way.
The strangest part, when planning on my procedure, my implant procedure, and my recovery, and even shortly thereafter, once I recovered, I wouldn't talk about it at all. I was very protective of my of my private life, and but now when you have a good thing that works, you know, and I'll be waiting in line in Kmart or whatever, Walmart, and I'm telling somebody behind me, you know, hey, you know,
Right.
I'm not afraid to talk about it anymore, because if you fell into a hole and you can't get out, you know, with an implant, you'll be soaring high.
Right, that's what I found. When guys have the problem, they're often reluctant to talk about it. But when they've got the solution, they're much more willing to let other people know that they got the solution.
I'm very happy. I'm extremely happy. Thanks again.
All right,
Dr.
thanks a lot,
Thank you.
Sam. We really appreciate your thoughts and your
Quite
information.
welcome, anytime.